Hello, and this is my first time using the Screen-O-Matic, so you can see the screen as I talk. So we're going to talk about Chapter 8. Sorry. And this is Principles of Emergency and Trauma Nursing. When we talk about trauma nursing, we talk about there's priority concepts in this chapter, which are safety, teamwork and collaboration, and communication. When we think of safety, we typically think of keeping the patient safe. But in today's world, especially with the pandemic of the COVID-19 coronavirus going on, we need to keep safety concerns for healthcare workers in the background. And we need to communicate effectively so we understand what's going on and work together as a team, because we're working with different people in the community, such as EMT and paramedics, physicians, social services, family members. When we're in the emergency department, we are there to provide services to all seeking care. We need to be responsible for safety via public surveillance and have disaster preparedness emergency. Some hospitals vary in size, so we need to be aware of that. We also need that those critical access hospital centers for Medicare and Medicaid have designated small rural facilities with 25 inpatient beds or fewer as critical access hospitals. This is one you can see in like Pike County, Missouri, and Louisiana. They have a small ER and a small med-surg unit. They also have a swing bed if patients need physical therapy afterwards. There's also multi-specialty environments in the ER. We'll see patients that we see will need a variety of care. So we'll see different patients during a given shift. The emergency nurse may function as a cardiac nurse, a geriatric nurse, a psychiatric nurse, a pediatric nurse, and a trauma nurse. Patient security ranges from life-threatening emergencies, such as chest pain and having a myocardial infarction, to minor symptoms that could be addressed at their primary care office, but they may not have one. Most common reasons people come to the ER is abdominal pain, chest pain, shortness of breath, injuries, possibly falls in the elderly or children with broken bones. They can have a headache, fever, and pain seems to be the most common symptom, and pain anywhere. My favorite ER patients, if you haven't heard, are dental pain patients, so be aware you'll see those in today's society in the ER. Not as much now with the pandemic going on. You never know what kind of patients are going to come in. So the ER setting is rapidly changing, fast-paced, and stimulating. Some of you did your ER rotation, it might have been a slow morning, but as the day went on, the pace typically picks up in the afternoon after the lunch hour. It's challenging and stimulating because you never know what's going to walk through the front door. Patients that you're going to take care of in the ER, your vulnerable populations include homeless, the poor, patients with mental health issues, patients who have substance abuse issues, and more likely you're going to see the older adult than a younger adult. You're going to have to respect various culture and religious values. You may also see language barriers, and you have to use a special telephone. I've already went over that. Special nursing teams. You may see forensic nurse examiners. These people deal with high-risk populations, and they're identified as sexual assault nurse examiners. They're able to offer counseling and follow-up care for victims of rape, child abuse, and domestic violence. I think we have one actual SANE nurse in our ER. They're also known as SAFE nurses, which is sexual assault forensic examiners. And these people will get called into court to testify what they observed during an examination. on someone who was possibly raped. There's also, in larger hospitals, psychiatric crisis nurse teams. These patients or these nurses work with acute or chronic mental health disorders. These nurses are also educated to interact with patients and family when sudden illness or serious injury or death of a loved one may have caused a crisis. As we work together in the emergency department, when you did your rotation, hopefully you got to do at least one. Emergency nurses are that's you, or going to be you. We also work with pre-hospital emergency medical service, and the goal of EMS is to provide emergency care to clients as quickly as possible, and to ensure that the right client arrives at the right hospital in the least amount of time. So if they're going out on a call to a nursing home, they want to get them transported pretty quickly to the hospital so we can start treatment. A lot of patients at the nursing home may be septic from a urinary tract infection, so EMS will go ahead and put an IV and start some fluids to kind of rehydrate the patient. They're not going to give meds typically unless needed for pain. Also, we're going to have physicians, nurse practitioners, and PAs, physician assistants. So you're going to need to communicate effectively with them. You're also going to have your hospital techs. And when we talk about professional and ancillary support staff, that could be radiology, registration, the social worker, or clerical staff. And when we communicate to patient, when we give handoff, we also are going to hand off these patients if they get admitted to the medical floor, be transferred to a larger hospital. We're going to use SBAR, like you did in clinical when you gave a report at the end of the day. And remember, SBAR stands for situation, background, your assessment, and what you recommended. So if we're going to give our patient to an ICU nurse with chest pain, an example is, I have a 57-year-old male who complains of chest pain. His chest pain started 4 hours ago. On arrival, I gave 3 nitro to treat his chest pain. His lung sounds were clear on auscultation. He has no edema. I put an 18 gauge IV in the right AC. I did forget to mention that his heart sounds were normal. We gave him a 1 liter bolus. He has no edema noted. He complains of no nausea or vomiting. He last voided this morning. The doctor has recommended to observe him for 24 hours in the ER or in the ICU, and to possibly consult cardiology and have a stress test in the morning. And that is an example of SBAR. In this picture, there's just some EMS loading up a patient or bringing a patient. Also, we have helicopters that fly everywhere now, so be aware of them. I talked about SBAR and did that on the previous slide. SBAR has been shown to be the most effective in giving handoffs. In today's society, we want to make sure we're safe and the patient's safe. So how do we make sure staff is safe? Well, in today's society and in the changing world of the pandemic, we're treating as every patient is in droplet precautions. So every nurse is assigned a mask, goggles to keep on their shift for 12 hours. The emergency nurse needs to use standard precautions at all times when there's potential for contamination by blood or other bodily fluid. If we had a patient that we suspected had the COVID-19 that's out there, we're going to put on the goggles, the mask, the bouffant, which is the hair cover thing, and a gown. If we think bodily fluids are going to be on the ground, we also may put in the shoe booties on. We need to put these patients with the COVID-19 or tuberculosis in negative pressure rooms if available. And I said that they're gonna wear the N95 mask or powered air purifying respirator, which is known as a PAPR. And if our patients, many EDs have at least one security guard present at all times. Currently, ours is at an entrance of the ER door greeting you. Some emergency departments will have metal detectors. When we think of patient safety, we're going to identify our patient using two patient identifiers. We're going to keep their bed in low position with both side rails up, even if they're alert and oriented. Patients it's a new environment to them, so we want both side rails up. We're going to check their name bracelet for adverse effects when we scan it to make sure we have the right patient. We also need to assess their allergies. If our patient is a mental health patient, we need to search the patient's belongings for weapons or other harmful devices when he or she has altered mental status. If the patient's unconscious, we may want to check their medical alert bracelet. I went back to the slide, sorry, I just want to make sure I covered everything. Core competencies. What makes an ER nurse competent? Well, we know they need to do assessment. They care for nurse patients from birth to death and all health conditions that prompt a person of any age to seek emergency care assessment. They need to be able to rapidly and accurately interpret assessment findings according to acuity and age. So you have to, when you're an emergency department nurse, you have to identify that bottling may be normal in a newborn, but can indicate poor peripheral perfusion and a shock state in an adult. We want to assess the patient's previous history to understand pre-existing diseases. Patients may give vague symptoms, so you have to ask more specific questions. Patients may say they've had chest pain, but they might not also tell you that they've had a cough or upper respiratory infection for 3 days. Clinical decision making. What patient do you see first? And we'll go over that in a couple of slides. I might have to start anew. We'll use that when we go over how to assess what patient you see first. Multitasking. What's your priority? Do you do the EKG first or the IV for chest pain? Hopefully there's two of you so you can do both at the same time. I would do the EKG. Document. You have to document everything you do. You need to be able to communicate with patients and patients' family members. You have to have a knowledge base to treat a code blue to a dental pain. You might also see less common occurrences such as a snake bite or get hazard material of chemical in somebody's eye at a plant in the community. You also have to deal with legal implications of society's problem. Does this person have a guardian? Is this mom, grandma? Who's living with this patient? You have to be flexible and adaptable during your day. You have to have a priority set. In the triage process, we need a quick, accurate assessment along with good critical thinking and clinical decision-making skills. You're going to collaborate with different departments. In your training certification, you're going to have your basic life support. You're going to have your advanced cardiac life support. And you also may need pediatric advanced life support. ACLS and PALS build advanced concepts in cardiac monitoring. They teach you invasive airway management, pharmacological therapies, intraosseous access techniques. We also need to prioritize for a patient. What nurse would be a good nurse to float to the ER? Would it be an OB nurse that maybe worked in the past in an ER? Or would it be a new grad who works with pediatric patients all day? Probably the nurse that worked in OB that had the previous ER experience.